Hi, I'm Angie Kristic, and welcome to HEALTHWATCH New York, where every week we examine some of New York City's healthcare issues and also look at how regular New Yorkers, doctors, teachers, administrators, practitioners, are coming up with solutions for New York City's healthcare problems. Tonight, we'll meet two medical detectives. One helps patients avoid unnecessary and excessive charges on their bills. The other steps in when insurance companies deny hospitals and doctors compensation for medical care. And will profile a remarkable therapy that can aid in recovery from chronic pain or injury, or even help a special needs child learn to walk. You've had a bad fall in the street or an acute medical emergency, a heart attack or a seizure. In crisis that follows, the last thing you're worrying about is what it will all cost. But the bills will come. And sometimes they're almost as frightening as the disease or injury itself. Adria Gross, a kind of medical detective and patient advocate, helps patients sort through what can become a maze of charges that sometimes are too expensive or just plain wrong.
I open MedWise Billing to help attorneys with big personal injury cases, helping them save money, and I also help any individuals that have issues with their insurance company. I handled a case where a woman had fallen down in a hotel, and she asked me to help her because the bills from the insurance company, if she was to win her case, they were adding up to over $100,000. And she asked me to look at her bills because she felt that most of them were not related to her injury, because the insurance company doesn't take the time to go through it themselves. They don't authorize it within their offices, and they just will take a look at a time period for that when the incident happened, and they will send out bills, not really combing through them to see what's related to the injury and what's not. So we went through the bills, and a lot of them were not related to the injury. For instance, diabetes, sleep apnea, diarrhea. So we figured out what was related, what was not related to the injury, and saved her well over $60,000. It wouldn't have to be paid back to the insurance company.
But the major problem Ms. Gross contends with is not unrelated charges billed by hospitals. It's denials and delays by insurance companies when it comes to charges incurred by the patients themselves.
When someone's in the hospital and they have surgery, very often what happens is, let's say an anesthesiologist will be there during the surgery, but the anesthesiologist doesn't have a contract with your insurance company, and therefore you are liable to pay the entire fees that the anesthesiologist is charging you for. Many times they have not had a contract with them for 1 or 2 years, and the insurance company, when you see it on the internet, they never take that doctor's name off of their website. There's a case that I'm working on right now where this woman has medical bills from 2 different areas of this insurance company. And the first time we sent in her bills, they came back to us saying that they needed diagnoses and the NPI number, which is National Provider Identification Number. We resubmitted it with that information. They came back to us asking for other information they already had. When we told them that you already have this information, they informed us that they had thrown out some of her original bills. We sent back a letter to them explaining to them how upsetting it was for them to just go ahead and throw some of the bills in the garbage. We sent in copies again, and again they came back asking for additional information. We wrote letters to the state insurance department. We wrote letters to the CEO of the company that's handling her medical bills. We also sent in a letter to the state legislators and the federal legislatures for her area. There were 10 different letters that were sent out to all these different departments to find out if and when they're going to pay her claim.
We were surprised to find out that some major insurance companies handle calls about complex medical procedures the way some businesses handle tech support.
When you call an insurance company, very often you wind up getting a call center overseas. I have someone who's in India, the Philippines, Jamaica, and they have a difficult time understanding exactly the U.S. insurance companies and how claims are handled. And they don't have answers, and you go around in circles trying to speak to someone. Often they say, well, just call back again, and hopefully you'll receive someone in the United States who can understand what it is you're questioning. A lot of time, an insurance case could take anywhere from 2 to 5 years before it's finally settled.
Many of the people Ms. Gross has helped with their billing issues wanted to speak about the effectiveness of her services. However, they're currently involved in ongoing legal cases with their insurance companies and were not allowed to publicly comment on how Ms. Gross assisted them.